Taking a good care of health is a part of wealthy economy and stable society, as they have the energy and ability to further develop the economy and society. Those who have good health don't pull others down, but they lift them up. Royal Address of His Majesty King Bhumibol Adulyadej. In Thailand, some people experience inequality in healthcare, which is rooted in a lack of political, social, and economic power. Most of such people are women, children, the aged, displaced people, ethnic minorities, inmates, people with disabilities, people suffering from chronic illness and conditions. Vulnerable populations are defined as those at greater risk for poor health status and healthcare access, and those without adequate potential access to care. Holistic and humanized care for people living with HIV/AIDS, PLWHAs, Bamrasnaradura Infectious Diseases Institute. Under the Thai public health system, care for HIV-infected persons or people living with HIV/AIDS is another important page in the Thai public health history that reflects multi-sectoral cooperation. The Bamrasnaradura Infectious Diseases Institute is an important agency that plays a key role in communicable disease control of Thailand. The Bamrasnaradura Infectious Disease Institute, previously known as Infectious Disease Hospital in the past, has been an important agency responsible for the control of many major infectious diseases, according to the disease control guidance of the Ministry of Public Health since 1960. Dr. Jariya Sangsajja, Director, Bamrasnaradura Infectious Diseases Institute, said the institute is a lead agency working on communicable diseases, highly contagious diseases, and hospital-acquired diseases at the country and international levels. In principle, the services cover physical and mental aspects, minimizing social impacts, providing full-cycle care by all personnel. During the first phase of the AIDS epidemic, when the first case of HIV infection in Thailand was detected in 1985, the Institute was the first agency that officially took charge of the control of the disease by law. At that time, the disease was new to the country. The knowledge about its nature and mode of transmission was unclear, and there were no specific or efficacious medications for treating it, so the case fatality rate was very high. Dr. Somsit Tansupa Sawattikul said, at that time, people were extremely scared and disgusted with AIDS because of the unknown nature of the disease. Over the first 20 years that we took good care of about 1,000 severe patients, we gained lots of experiences and could set many good examples of care. Since then, we have never had any case of hospital-acquired HIV infections among our hospital staff. Today, the severity has declined since the introduction of antiretroviral drugs. Later on, the Thai public health system developed an antiretroviral therapy system with efficient accessibility to low-priced antiretroviral drugs, and the HIV/AIDS treatment guidelines of the Institute have been further developed according to the changing situations. Furthermore, other relevant efforts have also been made, especially in relation to knowledge enhancement, personnel capacity building, and holistic care by a multidisciplinary team, emphasizing the psychological aspect of patients. At present, the Institute has adopted a non-discriminatory approach to medical care. Mrs. Puttiporn Limpana Dusadi, registered nurse with 30 years of experience, said, "We take care of the patients with compassion and love. The doctors give medication and the nurses provide holistic care. If any patients have psychological problems, their physical health will deteriorate. So we always tell them to keep fighting and get stronger." Based on past experiences, the management and development of knowledge has led to the development of an efficient treatment model that is being practiced at this tuberculosis clinic. This tuberculosis clinic, using the one-stop service approach, separated from other units but linked to the screening system of the front office service units, provides examination, diagnostic, and treatment services, including drug dispensing and counseling in the same area. This approach ensures the safety for service receivers as the premises have been properly designed with good systems of air ventilation. Dr. Wisit Prasiddhi Sirikun, Deputy Director for Technical Development on Infectious Diseases, said, "Firstly, we used a patient-centered approach in resolving the patient's problem. Finally, we have realized that all problems are interconnected, which later on require holistic care." Laboratory and medical technology services. All these supportive factors are necessary for the success in the treatment and control of the disease. Besides, psychological services for the patients as well as their families are important and provided by a counseling nurse, a psychologist, and a social worker, as well as other multidisciplinary team members. Such services are essential for boosting the morale of patients to live a better life. One HIV-positive patient said, "This place is different from others. I feel happy here with caring doctors, nurses, and other staff members. They provide treatment and care without discrimination, but give encouragement and everything else." A critical turning point in the care for HIV-infected patients is the eligibility for antiretroviral therapy under the Universal Health Coverage Scheme, as the government has implemented the national policy on accessibility to antiretroviral drugs for people living with HIV/AIDS. So the patients can just show their identification cards when they want to get their service eligibility verified. Dr. Sakchai Kanchanawatana, Acting Secretary General NHSO, said, "Vulnerable groups like HIV-positive people require our collective care. Nowadays, antiretroviral drugs are very efficacious. This group of people can create productivity for society after they have undergone treatment and rehabilitation. Upon re-entering society, they must not be stigmatized, but society must create the environment in which they can live together." Mr. Nimit Tien Udom, Director of the AIDS Access Foundation, said, "Problem solving is borderless and requires multi-sectoral collaboration and efforts at all levels within the country and abroad. This is a good example, but the key factor is internal mechanism. If there is no popular movement within the country, it would be difficult to move forward. Importantly, 100% of HIV-positive people have to get access to and receive antiretroviral drugs." Director, Bamrasnaradura, Infectious Disease Institute, said, "Even though today we've got antiretroviral therapy, it is not a radical cure. We can control the infection to a certain extent. Even so, in terms of social dimension, the medical services provided to the patient are not less than before. We are still interested in this matter so the patients can live a happy life in society." Having implemented HIV/AIDS services according to the aforementioned guidelines, in collaboration with other relevant agencies, including knowledge sharing, the Bamrasnaradura Infectious Diseases Institute has been designated by the World Health Organization as the WHO Collaborating Center for Training and Research on HIV/AIDS at the regional level.